121. While assessing an 84-year-old post-operative patient, the nurse observes that the patient suddenly becomes very anxious, appears cyanotic and has severe dyspnea. The nurse recognizes these symptoms to be consistent with A. Congestive heart failure, B. Pulmonary embolism, C. COPD exacerbation, D. Myocardial infarction. The answer is B. Pulmonary embolism. 122. When preparing an eye medication, the nurse reads the order OS. Medication is given into A. Both eyes, B. Left eye, C. Right eye, D. Infected eye. The answer is B. Left eye. 123. The client presented with complaints of body weakness, dizziness, and chest pain. Upon careful assessment, the nurse suspects angina pectoris. Which of the following statements made by the client can confirm this? A. I suddenly felt a pain on my chest, which radiates to my back and arms. B. I suddenly felt a sharp pain on my lower abdomen. C. The pain does not subside even if I rest. D. The pain goes all the way down to my stomach. The answer is A. I suddenly felt a pain on my chest, which radiates to my back and arms. 124. A patient has been taking aluminium hydroxide daily for 3 weeks. The nurse should be alert for which of the following side effects? A. Constipation, B. Flatulence, C. Nausea, D. Vomiting. The answer is A. Constipation. 125. The client from the OR is transferred to the post-anesthesia care unit after surgical repair of abdominal aortic aneurysm. Which of the following assessment findings would indicate that the repair was successful? A. Urine output of 50 milliliters per hour. B. Presence of non-pitting, peripheral edema. C. Clear scara. D. Presence of carotid brote. The answer is A. Urine output of 50 milliliters/hour. 126. The client is scheduled for cardiac catheterization because the physician wants to view the right side of the heart. Which of the following would the nurse expect to see in this procedure? A. A dye is injected to facilitate the viewing of the heart. B. Thallium is injected to facilitate the scintillation camera. C. The probe with a transducer tip is swallowed by the client. D. The tiny ultrasound probe is inserted into the coronary artery. The answer is A. A dye is injected to facilitate the viewing of the heart. 127. The client is being treated for hypovolemia. To assess the effectiveness of the treatment, the central venous pressure, CVP, of the client is being monitored. Which of the following is true about CVP? A. The CVP is measured with a central venous line in the inferior vena cava. B. The normal CVP is 7 to 9 mm of mercury. C. The 0 point on the transducer needs to be at the level of the left atrium. D. The client needs to be supine, with the head of the bed elevated at 45 degrees. The answer is D. The client needs to be supine, with the head of the bed elevated at 45 degrees. 128. The client's ECG tracing shows ventricular tachycardia secondary to low magnesium level. Which of the following electrocardiogram tracing results is consistent with this finding? A. The appearance of a U wave. B. Shortened ST segment and a widened T wave. C. Tall, peaked T waves. D. Tall T waves and depressed ST segment. The answer is D. Tall T waves and depressed ST segment. 129. The client with DKA is receiving bicarbonate for infusion for treatment of severe metabolic acidosis. The nurse notes that the latest ABG shows a pH of 7.0. What should the nurse keep in mind in giving the drug? A. Check vital signs before giving the drug and monitor serum sodium level. B. Perform a sensitivity test prior to drug administration. C. Mix the drug with D10W 500 ml for fluid and infuse for over 4 to 8 hours. D. Administer the drug slowly and monitor the potassium level. The answer is D. Administer the drug slowly and monitor the potassium level. 130. The client with a gunshot wound on the abdomen starts to get lethargic, is breathing heavily, and the wound dressing is fully soaked with blood. The nurse is expected to immediately perform which of the following actions? A. Loosen tight clothing and administer oxygen supply. B. Apply warm blanket to prevent heat loss. C. Apply large gauze on the bleeding site to put direct pressure or place a tourniquet on the artery near the bleeding site. D. Initiate for access. The answer is D. Initiate for access. 131. The nurse is providing home instructions to a client with increased adrenocorticotropic hormone. The nurse is aware that the client with excessive corticosteroids is suffering from what condition? A. Cushing's syndrome. B. Addison's disease. C. Hypothyroidism. D. SIAD. The answer is A. Cushing's syndrome. 132. An early sign of acute respiratory failure is A. Diaphoresis. B. Cyanosis. C. Restlessness. D. Orthopnea. The answer is C. Restlessness. 133. In caring for a woman and baby day 3 postnatally, she tells you that her baby has not had a bowel action since delivery. Your appropriate response would be A. Reassure the mother that it is quite normal for a baby to not move their bowels until day 5 after a few days of milk feeding. B. Start a bowel chart, document all findings, and wait another 48 hours before reporting to the physician. C. Encourage more frequent warm baths for the neonate with gentle abdomen massages. D. Tell the mother that you will let the physician know, so the baby can be checked for any obstruction. The answer is D. Tell the mother that you will let the physician know, so the baby can be checked for any obstruction. 134. A nurse prepares to set up a secondary intravenous, 4, cannula. The primary for infusing is normal saline. In order for the secondary cannula to infuse correctly, the nurse should set up the primary 4 to A. Hang higher than the secondary 4. B. Hang at the same level as the secondary 4. C. Hang lower than the secondary 4. D. Discontinue before the secondary 4 starts. The answer is C. Hang lower than the secondary 4. 135. Which of the following signs and symptoms of increased ICP after head trauma would appear first? A. Bradycardia. B. Large amounts of very dilute urine. C. Restlessness and confusion. D. Widened pulse pressure. The answer is C. Restlessness and confusion. 136. The healthcare provider is caring for a patient who has an implanted permanent pacemaker due to complete heart block and severe bradycardia. Which of the following should the healthcare provider assess first to determine pacemaker functioning? A. Pacemaker insertion site. B. Electrocardiogram (ECG). C. Apical pulse. D. Blood pressure. The answer is B. Electrocardiogram (ECG). 137. When assessing a patient diagnosed with osteoarthritis, OA, the healthcare provider looks for which characteristic of this condition? A. Decreased grip strength. B. Waddling gait. C. Bilateral joint swelling. D. Joint crepitus. The answer is C. Bilateral joint swelling. 138. After teaching a 54-year-old patient with angina on how to take 4 mg nitroglycerin sublingual tablet (PRN), which of the following statements reflects the patient understanding? A. I have to take this medication once I need it only. B. It's okay to take daily to prevent the heart attack. C. I can take 2 tablets together at once if the attack is strong. D. This medication will regulate my heartbeats and I will be okay. The answer is A. I have to take this medication once I need it only. 139. A 66-year-old woman presents to the emergency department triage unit with labored breathing. She appeared anxious and is sweating profusely across the forehead. The symptoms had begun suddenly 1 hour before. The jugular veins appear distended and she has a productive cough. On auscultation, the respiration are wet and not clear with coughing. Blood pressure 148/88 mmHg, heart rate 94 per minute, respiratory rate 26 per minute, and temperature 37.0 Celsius. Which triage acuity rating is most appropriate? A. Urgent. B. Emergent. C. Non-urgent. D. Resuscitation. The answer is A. Urgent. 140, 26-year-old woman is newly diagnosed with bipolar disorder and has been prescribed lithium carbonate 300 mg 4 times daily. 1 week after beginning the medication, she telephones the consulting nurse at the psychiatric clinic with complaints of diarrhea and blurred vision that had begun 1 day previously. The nurse schedules her come to the office to see the doctor that day. Which hormone imbalance is most likely? A. Estrogen. B. Luteinizing. C. Aldosterone. D. Thyroid-stimulating hormone. The answer is D. Thyroid-stimulating hormone.